Hello everyone. Now I am going to tell you about some more about DNA viruses as well as the other viruses in general. So what are the DNA viruses? The DNA viruses belongs to the Herpes viridae family. Now what are those viruses which belongs to the Herpes viridae family? So the first one is the herpes simplex virus 1, second one is the herpes simplex virus 2, and the one which is caused by varicella zoster, that is herpes reactivation of varicella zoster, that is human herpes virus 3 or varicella zoster virus. In addition to it, in herpes viridae we have the cytomegalovirus. Fine. So all these three belongs to the herpes viridae family. So all they are DNA viruses. Now how will the DNA viruses be? The DNA viruses will be linear. The DNA viruses will be circular. Enveloped. So this is how the DNA virus will be. Now what about the hepatitis virus? The hepatitis virus is also a DNA virus, but it will be circular. Herpes viridae family will be linear and it will be enveloped, but hepatitis virus will be linear and circular. What about human papilloma virus? Papilloma virus is also a DNA virus which is also circular, but in addition to it, it will be non-enveloped. What is a rotavirus? Rotavirus is the one which commonly causes diarrhea, right? So rotavirus is the RNA virus, but in addition to it, rotavirus is also double stranded and segmented. Influenza virus. Influenza virus is also RNA virus which is helical and segmented. I would advise you to remember the viruses and its associated features by heart, because they will be tested in the MLE exams. What about the methadone program? There is a question on it. The methadone program question is, they will give you like a patient who has been admitted in a methadone program and he has blurring vision or red eye with photophobia and with eye pain. So all pointing towards keratitis features. Now we should know that methadone is a drug which is an opioid antagonist. So this particular person who is mentioned in the vignette is having all features pertaining to keratitis, and he is in a methadone program which is an opioid antagonist. So because of the opioid use, he must have acquired HIV too. So we should know that this patient must be immunocompromised. So in immunocompromised, which keratitis is most common? Cytomegalovirus is most common. So therefore the treatment for that's how the question will be, and you need to derive from the question, and they will ask you what should be the treatment for the person. Ganciclovir should be the treatment. Fine. Now I have an elaborate video on the viruses as well as the treatment, and you will also have another question on a refractile body in the fundus. When they tell you like in the fundoscopy you see a refractile body. So what does the refractile body indicate? The refractile body indicates that there is a foreign body in the retina which can be visualized in the fundus. So now what is the next best step? That's how the question will ask you. The question will be framed at. So the next best step should be, if there is any foreign body in the which is visualized in the fundus, then it is mostly because of the carotid plaque. So the next best step should be to look for the degree of carotid occlusion. So either you can do a carotid duplex, or if that is not listed, then an ultrasound of the carotid has to be done to look for the degree of the carotid occlusion. Thank you for listening all this while. I wish you all the best for your exams.